Hey guys, this is Thomas over here from NurseMoneyTalk.com, and if you've ever been wondering what the difference really is between the NCLEX PN and the NCLEX RN, then stay tuned because that's exactly what I'm going to cover in this video. Now, before I get to that, if you're not already subscribed, I want to go ahead and invite you to hit that subscribe button on this channel. I talk about all things related to nursing student, and of course, nurse life. So let's go ahead and get right down to it. Now, for many of you, you're never really going to take both. Some of you will, but most of you, you're probably either just going to take the NCLEX PN or you're just going to take the NCLEX RN. As an FYI, I have actually taken both on my path to becoming an RN. I've kind of talked about it briefly in some of the videos about how you can challenge the NCLEX PN if you're like going through RN school. So I'll put that up there in the link above. So definitely check that out if you're interested. But as far as the differences and similarities between the exams go, most of you guys will probably be surprised to know that these exams, I think, have a lot more in common than they actually, have things that are different. I think it's important to know what those differences are, obviously, for when you're taking the exams, because those do make a difference in terms of how you prepare. But let's go ahead and cover the similarities, because that is, I think, the lion's share of where this comes up. I think it's important to note that, both exams, they test the knowledge of new nurses. As far as the questions are concerned, you're going to see a lot of probably similar questions, especially based on where the exams overlap. And I think they kind of overlap in a lot of different, as far as like the actual exam objectives go, they do overlap in a lot of places. But even as far as like the questions and prepping for it, I did notice that myself, that as I was preparing for both exams, so I took the NCLEX PN first, and so I remember I got some specific NCLEX PM, NCLEX preps, and then when I was preparing for the NCLEX RN, I noticed that a lot of these questions were very similar. I bought one of the NCLEX RN preps that I bought was actually from the same company that did the NCLEX PN, and I noticed that they were recycling a lot of the same practice questions. Not necessarily a bad thing per se. I mean, if they're similar, they're similar, but I do think that is something important to note. As the tests are scored using the CAT, so that's computer adaptive testing. I've covered all of that actually in a lot of other videos, but essentially it determines, how you're going to pass, or when, I should say, you're going to pass the NCLEX. The NCSBN, National Council of State Boards of Nursing, they're the ones that in charge, I should say, of the NCLEX PN and the NCLEX RN, so those similarities are there. Pearson VUE administers both of them, and even to the point of having similar kind of sign-ups, how you enroll, and even when you get to the testing side in terms of the check-in, check-out, the palm scans, the rules and whatnot, fairly similar as well. And even in terms of the number of questions. So this was changed. The NCSBN changed this. I believe it was like October 2020 when they changed it to where they both, the NCLEX PN and the NCLEX RN, have the same minimum number of questions and the same maximum number of questions. So it used to not be like this. So now they both have a minimum number of questions. So this is the number of questions that you will for sure answer will be 75, and then the max you're going to answer will be 145. It used to not, like I said, it used to not be this case. Like I think the minimum for the NCLEX PN exam, if I remember correctly, when I took it, it was the minimum number of questions was actually more than the minimum number of questions for the NCLEX RN. And it's important to note that they have the same, as of this point, 5-hour time limit. Now, if I'm going through and listing this out and you're wondering like, oh, wait, those are a lot of things that are similar. So are these exams actually different? They are. There's two things I'm gonna highlight that are the differences between these two exams. Before I get to that, once again, if you're not already subscribed, make sure to hit that subscribe button if you don't want to miss any of the new content that I'll be producing. And then also, if you find this video helpful, I would really appreciate the thumbs up. So let's go ahead and get to what the differences are. The first difference is that, and this might be obvious already, is that while both exams are to make sure that you're prepared as a new nurse, one exam, the NCLEX PN, it's for licensed practical nurses, licensed vocational nurses. The other one, the NCLEX RN, is for registered nurses. So in order to be eligible to take the NCLEX PN, you'd have to go to the appropriate, practical nursing school, and then go through all those steps. And then the same thing for the NCLEX RN. To be eligible, you have to graduate from an approved registered nursing school, or or whatever, which there's 2 tracks for that. You can go get your associates or your BSN for that. The second place where they differ, and to me this is the part where it gets the most interesting, is in terms of the content distribution. So this is kind of like the percentage, roughly, if you will, of where the focus is going to be at for the NCLEX. So for the NCLEX PN, they're focusing on physical adaptation, safety and infection control, health promotion, maintenance, psychosocial integrity, basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, and coordinated care. That's for the NCLEX PN. Now, for the NCLEX RN, they have the same kind of distribution, or in terms of where their focus, what they're going to focus on the exam, with 2 changes. So the NCLEX RN covers management of care, while the NCLEX PN does not. And remember when I said the NCLEX PN was covering the coordinated care? Well, the NCLEX RN does not. And then the other thing to note is that kind of like how they have the distribution in terms of what the percentage are going to be like are also a little different, and for some of them very different, between the NCLEX PN and the NCLEX RN. I'll actually just I'll try to put it on the screen. This was a table that I actually created on the blog post over there at nursemoneytalk.com. And I'll also put a link to the blog post in the descriptions below if you want to go ahead and check that out. And so you can instead of me just kind of rattling off numbers in a video or podcast, you can just kind of see it yourself. And while I'm at it, if you are if you're about to take the NCLEX and whatnot, and if you are looking for a good NCLEX prep, make sure to check out the NCLEX prep I recommend by going to nursemoneytalk.com/NCLEX prep. If you're watching this and you're just looking for a nursing school, check out nursemoneytalk.com/schools to find a nursing program. Now, the videos that you'll see that will show up, I think these are going to be videos that's going to talk more about the NCLEX, so definitely check out those videos if you are interested. Thank you so much for watching this video, and I'll catch you very soon in that next one.